Welcome. If you struggle with persistent congestion, you might be dealing with a deviated septum. Let's explore how septoplasty can help. First, what exactly is the nasal septum? The nasal septum is the internal wall that divides your nose into two equal chambers. It is made up of several different parts. The septal cartilage makes up the front part of the nasal septum. The perpendicular plate of ethmoid, or commonly called PPE, makes up the posterior upper part of the nasal septum, and the vomerine crest makes up the posterior lower part of the nasal septum. But what happens when this wall is misaligned? A deviated septum blocks airflow, leading to chronic nasal stuffiness that makes breathing feel like a constant struggle. In this example, we can see that the nasal septum is deviated to the right. The convexity is to the right side of the nasal septum, while the concavity is on the left side of the nasal septum. In this configuration, the nasal septum looks like an aeroplane wing. The convexity in the right nose will experience a drop in air pressure due to the Bernoulli phenomenon. The drop in air pressure in the right nose will cause further mucosal swelling and blood vessel vasodilation. This can worsen the nasal obstruction, increase mucus production and postnasal drip, and even cause the nose to bleed. This obstruction often results in painful sinus headaches and persistent snoring, disrupting your quality of sleep and daily comfort. The whole spectrum of symptoms caused by a deviated septum is best captured on the SNOT-22 questionnaire. The SNOT-22 questionnaire is short for the Sino-Nasal Outcomes Test. It is a 22-question survey used by sinus surgeons to measure the impact of your nose condition on different domains of your quality of life. These include facial fullness, ear pain, dizziness, difficulty falling asleep, waking up during the night, tiredness during the day, reduced productivity and concentration, and brain fog. If you are suffering, septoplasty is a proven solution. During the procedure, the surgeon gently straightens the nasal septum entirely from inside the nostrils. Because the approach is internal, there are absolutely no external skin scars. The surgery is performed under combined general and local anesthesia. The operation takes only 1 hour, and you should be able to be discharged after 6 hours. What can you expect after the surgery? You will be on hospitalization leave for at least 7 days. You will have lots of mucus production after the surgery as the immune system starts the process of healing. Some people may develop post-operative fatigue and fever due to chemokines and interleukins produced by the immune system. You may develop post-operative nosebleeds. This normally occurs between 7 to 21 days after surgery. The bleeding is not caused by the surgery. Instead, it is caused by new vessel formation during the healing process. We advise patients to avoid flying or going overseas for 30 days after surgery so that they can access medical care in case there is post-operative bleeding. For exercise, we advise low-intensity exercises for the first 2 weeks after surgery. This means that the heart rate should not exceed 100 beats per minute. For week 3 and 4, we advise moderate intensity exercises. This means heart rate can go up to 130 beats per minute. After 30 days, there are no more restrictions. You can fly around the world, train for your marathon or high rocks, scuba dive, or do anything else that you like. Septoplasty is highly effective. The quoted success rate in the medical literature is 65% to 85%. But our personal success rate is greater than 99%. The quoted post-operative bleeding rate is 2%. But our personal post-operative nose bleeding rate is less than 1%. Don't let nasal obstruction hold you back any longer. Consult us at our clinic to discuss if this procedure is the right choice for your needs. Visit us at our Nose and Sinus Treatment Clinic at Mount Elizabeth Medical Center along Orchard Road. Breathe easier today.